Eva, it's great to see you today. And I hope you're having a wonderful time in the UK and you guys are enjoying some good weather. I know that this is a good season for you, right?
Oh, it's been amazing. We've got a mini heat wave at the moment, which we're all trying to make the most of. So, yeah, life is good in the UK at the minute.
That's terrific. Well, I'm so glad to hear it. Well, we have another amazing topic today that is starting to gain some big concern, and especially in Europe. And I don't feel that the United States has taken the European advisory on finasteride quite as strongly as we should. And so, not that you and I are here to be politicians or to set new rules or medical statutes for the board, but I do think it's important for us to share with those individuals that are on finasteride a little bit more about what has recently been announced in Europe just as early as May of this year.
So, finasteride, as we know, is used in male pattern hair loss predominantly in the UK. It's not licensed in the UK for ladies that are not postmenopausal, and it's used as what we call a DHT blocker. And what that means is it stops the conversion of testosterone to dihydrotestosterone when it's binding to the hair follicle. To prevent the effects of it causing the hair to thin even more. But it doesn't come without side effects. And it's those side effects that are not always discussed or people are not aware of them. And also for us over here, we have got a huge amount of platforms that are just prescribing online. So they've not necessarily seen the person. And the risk with that is that if you don't really know your patient and your questions, your consultation aren't in depth enough, you could prescribe something that could be detrimental to that person, and particularly around mental health. Finasteride can cause anxiety and depression. And if you're somebody that's already suffering with that, for me, I wouldn't really be advising them to start taking it, because it can push them over into having suicidal thoughts. And I don't think that's discussed enough, and I don't think people are aware of it. It's almost like, oh, we use it to manage male pattern. Yes, you're over 18. Yes, you're a man. Yes, you can have it. And I don't think people understand the implications of it enough. What's your view?
Well, and I think, boy, a lot of things there. So, first of all, in the US, we have a lot of online pharmacies as well, and online hair loss specialists, i.e., proclaimed specialists that are trying to treat without running traditional labs, without having a foundation of dermatology or trichology. And so, I think that's more concerning for me. And when we talk about the use of finasteride, whether it's oral or topical. Now, I do want to point out for anyone listening is that this particular new finding, and I think focus on this finding, is really specific to men. Is that correct?
Yes.
Right. And so, and in the United States, right, we are also not FDA approved to prescribe finasteride. It's always considered an off label for hair growth. The only on label treatment that is FDA approved is minoxidil. And so I do think outside of, the taunted sexual side effect and ED issues that we see and have seen for 25 years when someone thinks about finasteride, I think this takes it to a very heightened level. And, we have spoke on many of our shows about the issues with depression and anxiety and how hair loss leaves individuals feeling, and male or female. And, I sat across the table from women who say, oh, this can't be as devastating to a man. They can shave their head. Think of all the actors and celebrities that look amazing with a bald head. And in some senses, they're right. But I see as many moist eyes when I speak to young men about this aggressive hair loss. And when they are 16, 18, 20 years old and are starting to feel like they're going down a never-ending path and are going to look like their father or their grandfather by the time they turn 30. So it's devastating for any of our populations. And I think it's so easy to turn to what the media wants to tell us is the right drug or the right solution. And goodness, I mean, the hair loss world is worth billions and billions of dollars. And so the online press and negative press, and sometimes not accurate press about products that are on the market and are online, are just challenging for us, I think, especially when you and I sit down and spend an hour and more speaking to a client and understanding truly what the root cause of the problem is. And if we find that they have some depression, either one genetically, right? And maybe they're not taking medication, or that they are taking medication for depression, anxiety. It's the very first thing I now bring to the forefront. And in the United States, we do not have the medical cards that I think that you're required to share when someone does prescribe finasteride. So it is something that I just think that will start to gain more awareness over time, I hope, without fearful consideration, but yet it will give everyone just a moment to pause and think if this is the right medication for them.
Definitely, definitely. And I work with a dermatologist in the UK called Dr. Archana Rao, and she specializes in the hair. She's amazing. And she always says, and I firmly believe it, that if you take a treatment that you're not really sure about, you're never ever going to get the full efficacy out of it, because that nagging anxiety is always going to mitigate what it might be able to do. And that's where I think more information is absolutely key, so people can make informed decisions, not just be led by my mate's using it, or it's in 50 online pharmacies, so it's just got to be fine. And I think that's what needs to happen, is that more informed decision making.
Yes. And, I mean, while the overall risk are relatively low, and especially if dosing is started out low, but I do think it's just making that information available to our patients and to our clients so they can truly make an informed decision. Finasteride, along with Minoxidil and all other forms of treatments and professional treatments, PRP, microneedling with exosomes and growth factors. There's so many opportunities for men and women that are causing additional stress in their lives with their hair loss. And as you and I know, and boy, I think we learned more during the pandemic, is the sooner that we start treating and preventing hair loss, the happier that everyone is going to be. So early detection, as they say, is a great solution in finding a path to a treatment.
So agree with that. I always say to my patients, the sooner I see somebody, the sooner I can diagnose it, the better the outcome, because the more we have to work with, the better we can retain.
Yes, exactly. Well, Eva, it's been a fascinating discussion on finasteride, and I hope we've been able to share some good information with our audience, not scare them, but at least give them a little caution to pause and think about what is the best treatment for them, and to make sure that they really do dig into each treatment that they start before, they just jump in. So yeah. Until next time, you have an amazing day.
And you too. Bye for now.
Bye-bye.